Thank you for staying with us on Citizen Sunday Live. In less than 3 hours, at least 400,000 teachers in the country will now access healthcare services through the Social Health Authority after a lapse of contract with Minet. SHA CEO Dr. Mwangangi, in an advisory, has directed hospitals to discharge teachers admitted under Medical Administrators Kenya Limited and readmit them under the SHA Public Officers Medical Fund scheme. The transition comes even as Teachers Service Commission directs Minet to provide all records to ensure a smooth transition. Gatete Njoroge reports.
Close to our heart.
After 10 years under a medical scheme administered by a consortium of insurance companies led by Minet Kenya Insurance Brokers, at least 400,000 teachers will from December 1st shift to Social Health Authority after months of deliberations between their employer, Teachers Service Commission and their unions. SHA CEO Dr. Mwangangi, in an advisory hours before the shift, has advised health providers to discharge all TSC teachers admitted under Medical Administrators Kenya Limited before midnight and readmit them under the SHA Public Officers Medical Fund scheme with clear timestamps for both discharge and readmission. She further directed that if biometric verification fails, hospitals should initiate whitelisting requests via their support channels and provide the patient's full name, ID number, and facility code. Dr. Mwangangi has told healthcare providers to ensure all procedures requiring pre-authorization follow the standard SHA process under the POMSF TSC scheme, and to avoid claims interruption, they should promptly sign the POMSF addendum. Preceding SHA advisory was a letter by Medical Administrators Kenya Limited to medical service providers, urging them to submit all claims in line with contractual provisions before the end of their contract. On their part, the teachers' employer TSC, in a letter to Sami Mudhui, the managing director Minet Kenya Insurance Brokers, urged them to provide the teachers and their dependents data to enable smooth transition. 3 weeks ago, during a consultative meeting to finalize the transition of teachers' medical cover, the teacher unions who agreed to the move warned that if it fails to serve the teaching fraternity, they would cancel it.
This scheme is going to improve much more what we had earlier.
The transition comes even as the Catholic Church continued with the push to urge the government to address challenges facing SHA. Nyeri Catholic Archdiocese Archbishop Anthony Muheria says despite Kenyans paying for SHA, most patients are detained in hospitals due to huge medical bills.
Ni kweli tunajaribu kutafuta suluhisho ama suluhu kwa haya mambo ya SHA, lakini tunajua kwa mambo bado kwa wengi ambao wanaugua magonjwa, kuna wengi ambao hawezi kulipa. Na hata wakiwa na SHA bado malipo inakuwa ya makubwa kulipo uwezo wao.
Archbishop Muheria was speaking at the launch of Sister Irene Nyada Golf Tournament, which aims at creating a fund to help patients unable to raise money for hospital bills, as SHA is no longer fully dependable. Gatete Njoroge, Citizen TV, Nairobi.